Good morning, Mrs. Jones. So your son James has come in complaining about some pain at the back right of his shoulder. He's mentioned that it's stiff and he's struggling to lift his arm over his head. He's also complained that it's a lot worse in winter when it's cold or when he's been out playing. If it's okay with you, we'd like to take a history and perform some physiological tests just to try and establish what the issue is. Would that be okay?
Yeah, that's perfect.
So after looking at James's history and his physiological test results, my initial prognosis is shoulder osteoarthritis. This is a disease that affects the cartilage and joint tissues around the shoulder. We most commonly see this in the over 60s due to gradual wear and tear, and this is normally called primary osteoarthritis. But in James's case, it's likely to be secondary, and this would be a result of the shoulder dislocation he suffered a few years ago. Due to the location of the pain being on the back of the shoulder as opposed to the top, it's quite likely that it's the glenohumeral joint that's affected. This is the ball and socket joint in the shoulder. The range of motion tests also show that the mobility is slightly limited, and I could also hear a lot of clicking and cracking, and both of these suggest osteoarthritis. I also noticed a lot of weakness in the right versus the left shoulder. The right shoulder is a lot less muscular. This is likely due to the osteoarthritis and the dislocated shoulder, resulting in him not using that shoulder as much, and that's creating a lot of imbalance. So if it's okay with you, we'd like to take an X-ray to test for severity and also take a blood test just to help rule out some other diseases. Would that be okay?
Yes, that's fine.
Here we can see an X-ray of James's right shoulder. If you look at where the arrow is pointing, you can see there is very little space between the humeral head and the glenoid fossa. This suggests there is not much cartilage protecting either bone and will result in a lot of friction. This explains the soreness and other symptoms he's been experiencing and confirms that he's suffering from osteoarthritis. This X-ray only suggests early stage osteoarthritis, so it is important that the disease is managed to stop it becoming more severe. For comparison, I've got an image of a normal shoulder and an image of a severely arthritic shoulder. As you can see, the severe case has very little space between the two bones when compared to the normal shoulder. This is similar to what we saw in the previous X-ray. The severe case also shows bone spurs or osteophytes. This is when the body compensates for the lack of cartilage by growing more bone. This reduces the space available for ligaments and tendons and could lead to tendonitis or rotator cuff tears in the future. If James's shoulder continues to get worse and he's feeling soreness in the shoulder muscles, then bone spurs could have developed. It is very important that if this happens, then he's brought back in for further checks. So after checking James's blood results, we can rule out rheumatoid arthritis. This is a disease that presents similar symptoms but would require very different treatment, and this further confirms our diagnosis of osteoarthritis. Thankfully, we found this quite early and treatment will be non-surgical. First, I'd recommend taking ibuprofen if the shoulder flares up and becomes painful. I suggest the liquid syrup version as it's a lot easier for younger children to swallow. If it flares up, I'd also suggest resting the shoulder and applying either hot or cold to the shoulder for 20 minutes or so. You can do this a few times a day to help reduce pain or reduce inflammation. Both work, so give them both a try and see which ones you find most effective. The final thing I'd recommend is some physiotherapy and range of motion exercises. It's important to still use the shoulder to strengthen the surrounding muscles and to improve mobility. We'll organise a session with the physiotherapist to help James with these exercises. Are you happy with this course of treatment, or do you have any questions?
I'm happy with the treatment plan, but what should we do if the shoulder gets any worse?
Well, if he starts experiencing any more pain, then bring him back to the hospital and we can run some further checks to see if the shoulder's worsened. We can use an MRI or a CT scan to see if any of the structures around the joint have been injured. If required, we can use some cortisone injections to relieve pain and reduce inflammation at the joint. If the shoulder were to get worse from that again, then we could look at surgery to replace part or all of the joint. But thankfully, as the issue has been identified so early, then hopefully we shouldn't have to go to that extreme. Do you have any more questions?
No, that's brilliant. Thank you.
Cheers, thank you.